She was 25 years old, sitting in a hospital room, alone, unable to form a single word. The right side of her face was drooping. Her arm had gone completely numb, and in that moment, she had no idea what was happening to her own body. She wasn't elderly. She had no history of heart disease. She had no warning. Just one ordinary morning that suddenly wasn't ordinary at all. Now, I want you to stay with me here, because this story isn't just her story. It's the story of every woman who has ever walked into a doctor's office and been told, everything looks fine, while something inside her knew it wasn't. Today, we're going to talk about 5 things that happen to women's bodies before pregnancy, during pregnancy, and after that the medical system consistently underestimates, underdiagnoses, and sometimes completely misses. We're talking about a hidden heart condition that affects 1 in 4 people and causes chronic migraines in women for years before anyone connects the dots. We're talking about a uterine condition that silently causes unexplained miscarriages and is missed on routine ultrasounds every single day. We're talking about postpartum hemorrhage, PMDD, and the recovery timeline that no one is honest with you about. If you have ever felt like your body was trying to tell you something and no one around you would listen, this video is for you. Stay with me, because by the end of this, you're going to understand your body in a way that might just change everything. Let's get into it. Part 1. The heart condition no one checked, the hidden risk living inside 1 in 4 women. Let me start with a question that I think most women have never been asked. Has anyone ever checked your heart for a patent foramen ovale? Probably not. Most doctors don't bring it up.
Most women don't know to ask.
And yet, right now, approximately 1 in 4 people listening to this has one. So what is it? A patent foramen ovale, or PFO, is a small opening between the 2 upper chambers of the heart. We are all born with it. It's a normal part of fetal development. In most babies, it closes naturally within the first few months of life. But in about 25% of the population, it never closes. And most of the time, you'd never know.
No symptoms.
No warning signs. People live full, healthy lives with a PFO and never experience a single complication. Until, in rare cases, a tiny blood clot that would normally travel to the lungs, be filtered out and dissolve, slips through that opening instead, and travels straight to the brain. That is what happened to the young woman in our story. I want you to pause here, because this is where it gets really important for us, as women. She had been living with severe, chronic migraines for years before her stroke. Debilitating ones. The kind that disrupted her life on a regular basis. And do you know what her doctor said? Nothing. Because frequent migraines, especially migraines with aura in women, are one of the most recognized yet most ignored warning signs of an undetected PFO. Think about that for a moment. How many women right now are living with chronic migraines, being handed pain medication, being told to reduce stress, being told it's hormonal, when the real answer might be sitting quietly in the structure of their heart? After her TI, her transient ischemic attack, what doctors call a mini stroke, she was sent to specialists. She pushed for answers. She refused to accept "we don't know" as a final diagnosis. And eventually, she had a closure procedure, a minimally invasive surgery where a small device, roughly the size of a button, is threaded through the groin, guided up into the heart, and used to seal that opening permanently. No open heart surgery, no cracking of the chest, just a button, and peace of mind for the rest of her life. Takeaway number 1. If you experience frequent unexplained migraines, especially migraines with visual disturbances or aura, it is worth having a direct conversation with your cardiologist about a bubble echo study or a transcranial Doppler test. Not because something is definitely wrong, but because knowing is always better than not knowing. You are not being dramatic by wanting answers. You are being smart. Part 2. The pregnancy complication that hides in plain sight, uterine septum, and the miscarriages no one could explain. Now I want to talk about something that I believe is one of the most underdiagnosed conditions in reproductive medicine today. The uterine septum.
Imagine a normal, healthy uterus.
Now imagine a thin wall of tissue growing down from the top of the cavity, dividing the space inside. That is a uterine septum. And most women who have one have absolutely no idea. It affects 1 to 3% of women. It is genetic, you're born with it. And it is commonly missed on a standard ultrasound. Not because the technology isn't there, but because if you don't know what to look for, if you don't do a 3D image of the uterine cavity, that thin wall is almost invisible. Here is why this matters so much. A moderate uterine septum carries a 25 to 40% risk of miscarriage and a 10 to 20% risk of preterm delivery. And yet, so many women with this condition go through loss after loss after loss, being told their labs are normal, their hormones are fine, their anatomy looks fine, with no one ever ordering the one image that would show the truth. Think about the women you know who have experienced recurrent miscarriages. The ones who have been told, "We don't know why this keeps happening." According to research, up to 15% of women with unexplained recurrent pregnancy loss have an undetected uterine septum. 15%. That is not a rare edge case. That is thousands of women carrying grief that might have had an explanation if someone had simply looked closely enough. The woman in our story knew about her septum before she got pregnant. Her doctor had flagged it, had said, *, we should keep an eye on this. We may want to address it before you conceive. And she, like so many of us, said okay, and filed it away, because she wasn't thinking about pregnancy yet. And then life happened, as it tends to do. She carried her pregnancy with a moderate septum. She was counseled on the risks, and she made a choice, grounded in intuition, grounded in trust with her care provider, to move forward. And it worked out. Her baby arrived healthy, but not every woman's story ends that way. And that is exactly why this information matters. Takeaway number 2, if you have experienced recurrent, unexplained miscarriages, or if you are planning to conceive and have never had a full uterine evaluation, ask your OBGYN specifically for a 3D ultrasound of your uterine cavity, not a standard scan.
À 3D image.
Ask for it by name, because it is the difference between seeing that wall and missing it entirely. Part 3. After the baby is born, the part no one posts on social media, postpartum hemorrhage, and what the delivery team needs to know: she pushed her baby out in 44 minutes. After nearly 18 hours of labor. And in that moment, she thought it was over. I did it. He's here. We made it. And then she couldn't stop bleeding. This is the part of birth stories that disappears from the highlight reel. The part that happens after the photos are taken. After the baby is placed on your chest.
When the nurses move faster.
When the room gets quieter in a way that doesn't feel like rest. When you look at your doctor's face and something in your gut shifts. Postpartum hemorrhage affects 2 to 4% of women after vaginal delivery, and up to 6 to 10% after cesarean section. The most common cause is called uterine atony, when the uterine muscles fail to contract properly after the placenta is delivered. Your body in that moment needs to clamp down, to close, to stop the flow. And sometimes, for reasons that are not always predictable, it doesn't. She had 0 risk factors. She was young. She was healthy. Her pregnancy had gone well. Her labor, while long, was uncomplicated. And it still happened, because the truth is, postpartum hemorrhage does not always follow the rules. She described lying there, aware that something was wrong, even through the exhaustion, sensing the urgency in the room before she fully understood it, asking the same question over and over. Am I okay? And being told, you're going to be fine. What she didn't fully grasp in that moment was just how fast her care team was moving. Medication after medication. One intervention, then another. Until finally, a device that uses gentle suction to compress the walls of the uterus from the inside did what nothing else could. The bleeding stopped. She went home. She healed. But not every woman has that outcome. And the difference so often comes down to how quickly the team responds and how prepared they are. Takeaway number 3. Before your delivery, whether that is weeks away or months away, have a conversation with your care provider about their protocol for postpartum hemorrhage. Ask what tools they have available. Ask how quickly they can respond. Ask what your options are if standard medications don't work. You are not being paranoid by asking these questions. You are being prepared. And prepared women have better outcomes. Part 4. PMDD, when your own brain works against you, the condition that makes you feel like you're losing your mind. Every single month, I want to slow down here. Because this next part, I think this is the part that most women in this audience have been waiting for someone to talk about. Honestly, without making it feel small.
PMDD.
Premenstrual dysphoric disorder. Here is what it feels like from the inside. For about 5 days before your period starts, everything feels catastrophic. Not uncomfortable, not a little irritable.
Catastrophic.
The small argument with your partner feels like the end of the relationship. The work deadline feels like proof that you're failing at life. The distance you feel from the people you love feels permanent. And the thoughts that come, the spiraling, the darkness, the sense that nothing is ever going to be okay, feel completely, terrifyingly real. And then your period starts. And within 48 hours, sometimes less, it lifts. All of it, like a switch was flipped. And you're left standing there thinking, asterisk, why was I so convinced that my entire life was falling apart? Asterisk, that is PMDD. And it is not a character flaw.
It is not weakness.
It is not you being too much. It is a neurological condition. Here is the science, in plain language. After ovulation, your body produces progesterone. Progesterone converts into a compound called allopregnanolone. In most women, allopregnanolone binds to receptors in the brain called GABA receptors, and the effect is calming,
stabilizing,
like a gentle anchor. But in women with PMDD, the brain reads that same signal differently. Instead of calm, it produces anxiety. Instead of stability, it produces depression. Instead of groundedness, it produces irritability, brain fog, emotional flooding, and a complete disconnection from your sense of self. Every single cycle. PMDD affects 3 to 8% of women, and the risk of suicide in women with untreated PMDD is real. This is not a dramatic diagnosis. This is a serious condition that deserves serious attention. The woman in our story developed PMDD 6 months after giving birth. She had never experienced it before pregnancy. And this is something important to understand. True PMDD, clinically speaking, would typically be present before pregnancy as well. What she experienced was more likely a postpartum hormonal trigger, the massive hormonal shift that follows childbirth disrupting how her brain processed its own chemistry. Her therapist told her it would likely improve with time. And it did, gradually, month by month, cycle by cycle. The intensity softened. The windows of clarity grew longer. But while she was in the middle of it, here is what helped. Supplements, quercetin, a plant-based, anti-inflammatory that helps regulate histamine and reduce systemic inflammation. Diindolylmethane, supports healthy estrogen metabolism and hormone balance. Magnesium, one of the most evidence-supported supplements for PMS and PMDD symptoms, particularly for mood regulation and nervous system support. Calcium, shown in studies to reduce the emotional and physical symptoms of PMDD when taken consistently throughout the cycle. Lifestyle, reducing or eliminating alcohol, which dramatically worsens hormonal sensitivity and inflammation. Consistent aerobic exercise, which directly supports GABA receptor function and mood regulation. Anti-inflammatory eating, reducing processed foods, refined sugar, and foods that spike histamine levels. She also found that antihistamines provided unexpected relief, and her personal theory is that her PMDD was linked to histamine intolerance. While the research here is still emerging, there is a growing body of evidence connecting estrogen-driven histamine spikes to cyclical mood dysregulation in women. It is a conversation worth having with your doctor. And if supplements and lifestyle changes are not enough, there is a treatment option that most women have never heard of: pulsed SSRI therapy. Instead of taking an antidepressant every single day, you take it only during the 10 days before your period, the luteal phase, that specific neurological window when your brain is most vulnerable to its own hormonal signals. And then you stop until next cycle. The brain in that specific hormonal state is remarkably disproportionately responsive to medications like fluoxetine, sertraline, or escitalopram, even at low doses, even for just 10 days a month. This is not a lifelong commitment. This is a targeted intervention for a targeted window. And for many women, it is life-changing. Takeaway number 4. If you experience severe cyclic emotional distress in the 1 to 2 weeks before your period, please say these words to your doctor. Asterisk, I think I may have PMDD. I want to talk about cycle-based symptom tracking and evidence-based treatment options. Asterisk, bring a symptom journal if you can. Track your cycle. Note when the darkness starts and when it lifts. The pattern is the diagnosis. And if your doctor dismisses you, find another doctor, because PMDD is real, your suffering is real, and you deserve care that takes it seriously. Part 5. The recovery no one is honest about postpartum is not 6 weeks. It's a full year. Let's talk about something that I think the wellness industry gets profoundly, harmfully wrong. The postpartum timeline. The woman in our story gained significant weight during pregnancy. Normal, expected, healthy. She lost a large portion of it simply from giving birth and the first days in the hospital. And then she hit a plateau. The last stretch of weight, it didn't move. For months.
Even though she was breastfeeding, even though she was exercising,
Even though she was doing everything the internet told her to do. And she heard the same things so many new mothers hear. Asterisk, oh, you're breastfeeding? The weight will just fall off you. Asterisk, let me be direct about this. That is a myth. And it does real harm. For some women, breastfeeding does accelerate postpartum weight loss. For many women, it does the opposite. Your body is extraordinarily intelligent. When you are producing milk, it holds onto energy reserves to protect that production. And at the same time, you are more hungry than you have ever been, more thirsty, more depleted. Your body is running a physiological marathon every single day, and it needs fuel to do it. Expecting it to simultaneously shed weight rapidly is asking the impossible. What she emphasized, and what I want every postpartum woman to hear, is that recovery after birth is not about losing. It is about rebuilding. Pelvic floor therapy. Before pregnancy, if possible. During pregnancy. And absolutely after. Your pelvic floor is a complex group of muscles that supports your bladder, your bowel, your uterus, your sexual function, and your core stability. Pregnancy and birth change it. And it deserves professional rehabilitation. Not just time, not just Kegel exercises you found on Google, but actual hands-on, specialized physical therapy. Even 4 sessions can make a measurable difference. Rib rehabilitation. This one surprises people. Your rib cage actually expands during pregnancy, sometimes significantly, to accommodate your growing baby and shifting organs. After birth, it doesn't always return on its own. Targeted breath work and specific strength training can help bring it back. Relaxin awareness. The hormone relaxin, which loosens your joints and ligaments during pregnancy to allow for birth, stays elevated in your body for months postpartum. Sometimes longer if you are breastfeeding. This means your joints are more vulnerable. Your risk of injury is higher if you return to intense exercise. Too quickly. Move. Stay active, but move gently. And give your connective tissue the time it needs to stabilize. And then there is this. The single most important thing I want you to take from this entire section. Postpartum is not 6 weeks. The 6-week clearance your doctor gives you at your postpartum visit, that refers to wound healing, your C-section incision, your perineal tears, the physical surface of recovery.
it does not mean your body is restored.
Full recovery after pregnancy, hormonal, neurological, musculoskeletal, emotional, takes up to 1 full year. Your hair loss peaks at 3 to 4 months and gradually resolves. Your hormones don't fully stabilize until 6 to 12 months postpartum. Vaginal dryness, skin changes, mood fluctuations, all of it is still actively shifting long after that 6-week appointment. Give yourself the year, not because you are weak, but because you did something extraordinary. And extraordinary things take time to heal from. Takeaway number 5. Invest in your postpartum rehabilitation the same way you would invest in physical therapy after any major medical event. Because that is exactly what birth is. Start with pelvic floor therapy, even if you feel fine, even if nothing feels broken. Because reconnecting to your body, intentionally, professionally, with guidance, is one of the most loving things you can do for yourself in the months after birth. So, let's come back to where we started. A young woman, sitting in a hospital room, unable to speak, afraid, alone with a body she suddenly didn't recognize. She didn't know, in that moment, that the experience she was living through would one day give language to thousands of other women's stories. She didn't know that her migraines had been trying to tell her something for years. She didn't know that the grief she would carry in those 5 impossible days every month had a name. She didn't know that her body, even in its most frightening moments, was doing exactly what it was designed to do. Trying to survive, trying to heal, trying to be heard. Here is what I want you to carry with you from everything we talked about today. 1. A PFO affects 1 in 4 people. Chronic migraines in women are not just a nuisance. They may be a signal worth investigating.
2.
Uterine septums are commonly missed.
If
you have experienced unexplained pregnancy loss, ask for a 3D uterine ultrasound. By name. 3. Postpartum hemorrhage can happen to anyone, regardless of age, health, or risk profile. Know your birth team's protocol. Be prepared.
4.
PMDD is real. It is neurological. It is not a personality flaw. And there are evidence-based treatments that can genuinely change your quality of life, starting with the conversation you have with your doctor at your next appointment.
5.
Postpartum recovery takes a full year, not 6 weeks.
A year. Give your body that time.
Give yourself that grace. And here is the thread that connects all of it, the one thing that runs underneath every story we tell on this channel. You cannot build secure love with another person until you feel safe inside your own body. Secure attachment, the kind that lasts, the kind that heals, the kind that actually holds, starts with believing that your experience is real, that your pain deserves attention, that your body is not the problem, and that you are worthy of care that actually sees you. If something in this video landed for you today, I want to hear about it. Drop a comment below and tell me, which of these 5 things do you wish someone had told you sooner? And if you know a woman who is pregnant, postpartum, or silently struggling with something she hasn't been able to name, please share this video with her. Because sometimes the most healing thing we can offer someone is simply this, a name for what they've been feeling. And the reminder that they are not alone. Thank you so much for being here. I'll see you next week. Blue Heart.